because if it falls on the floor, we probably won't be able
Thank you,
to find
Amy.
it.
I am delighted to have this endorsement, humble, and we will get the job done when we become governor with your help.
You know what?
The work that you're
Let's be
doing
careful
could not be
because
more
I think
important
I'm
for
gonna hold
Vermont
on to
children.
these and maybe we can do some,
I am excited about
pictures
serving
with them.
as
You
Vermont's
paint them
governor,
up and
but I can
stamp
tell
them
you
on
that I
paper.
do not want to be governor so bad,
Apple star.
that I will undermine a good person's character or tell untruths about what they want to do if elected governor to be elected governor. I pledge over the next 4 weeks that we're going to talk about the issues that Vermonters care about. That is what Vermonters deserve in this election, and that's what they'll get from me. I want to say a piece that is critical to the work that's being done here today and across the state with early child educators. We cannot provide good, quality early child education if our kids are not healthy.
Let's show Melinda what
Brian Doobie and I have sharp differences on this question. Brian Doobie's plan to impose a 2% cap on budgets will result in children being removed from health care access to Dr. Dinosaur that Howard Dean, Governor Kuhn, and I have fought so hard for. I believe that this is an area where Vermonters need to know how different our vision is.
So what did we do?
Brian's priority of giving 1,400 wealthiest Vermonters income tax cuts
So what did we do with the
and
pieces of that?
removing children from Dr. Dinosaur as a result is absolutely opposed to the plan that I have presented. We must ensure that we succeed in getting Dr. Dinosaur health care coverage, health insurance to every Vermont child, and I will never balance the budget on the backs of our children who need health care services. It costs us more in the end. What do I mean? If, in fact, Brian goes forward with his plan,
That was our
balancing the budget next year, and then a 2% budget cap for the following 3 years, here is the result. It will mean, in the first year, 2013, 455 children are removed from Dr. Dinosaur health care coverage. It will mean, in the second year, that 910 children are removed from health care coverage. It will mean, in the third year, that nearly 2,500 children are removed from Dr. Dinosaur, have no health insurance. That, in my view, would be a terrible judgment to make as governor. So here is what I pledge to you. I have a long record of balancing budgets. We will get it done. But we have never done it on the backs of Vermont's children. Right now, we have, according to VISCA, 3,100 uninsured Vermont children. 2,700 of them are eligible for Dr. Dinosaur, but have not had the proper outreach to get them there. I will pledge to ensure that we get the outreach done, that we do not cap the budget so that we can give 1,400 Vermonters who make $373,000 a year or more a tax cut in order to grow kids off of Dr. Dinosaur. That is not a plan that I would accept. It's not a plan that's in the way that we do things in Vermont. It's not the Vermont way, and that's an area where we strongly disagree. Be happy to take any questions, but let's be clear. Brian Doobie's plan to cap budget growth will result in 2,500 Vermont kids being removed from Dr. Dinosaur in its third year. I will not balance the budget on the backs of our children to ensure that we give tax cuts to the wealthiest 1,400 income taxpayers in Vermont. There's a clear difference. There's a reason, a choice, a clear distinction between the two of us. I'm happy to take any questions.
Yeah, where do you get your numbers?
Well, our numbers come from joint fiscal in terms of the budget spending. You know, one of the things that I have found so far that has been a bit disappointing about this campaign is that we're not digging into what it means to cap state spending at 2% across the board, 2013, 2014,
I'll
and
get colors and stuff.
This is the result.
Needs to put the
If you were to do that, here's how the math works. Over the past 4 years, Dr. Dinosaur average spending has increased 11%. That's not inflation, it's also utilization, more people enrolling. Assuming that 11% over the last 4 years is a reasonable conclusion of what one would expect in the future, you can quickly figure out who gets thrown off, how many get thrown off, if you cap spending at 2%. That's the result. You cannot cap state spending to give the wealthiest 1,400 Vermonters a $250 million tax break without consequences. These are the consequences. These are the choices. I would not make this choice as your governor, Brian would.
But how can you say that he would throw them off? I mean, couldn't he cut the budget elsewhere in order to preserve Dr. Dinosaur?
He's talking about a 2% across the board spending cut. If in fact he has another plan, let's ask him what that plan is. It's Brian's responsibility to explain to Vermonters how he would make the cuts. But there's no magic here. If you make a 2% across the board cut, this is the result. 455 kids removed from Dr. Dinosaur the first year, 910 kids removed from Dr. Dinosaur the second year, 2,544 kids removed from Dr. Dinosaur the third year. That's in 2015. That is just wrong.
So how would you fund this 11% increase in Dr. Dinosaur's budget?
You know, the difference between myself and Brian is I've written budgets, I've negotiated budgets, I've voted on budgets, and I've delivered balanced budgets. I have a record. Brian doesn't. You don't need someone right now who needs a learner's permit to write a budget. You need someone who has an experience with a driver's license. Here's where we are. As you know, 2 years ago, I worked together with the Speaker and the Governor. We cut $168 million in the budget. We did not do it on the backs of Vermont's children who need access to health insurance. Last year, $158 million. And we cut broad-based taxes. We did not do it on the backs of Vermont's children who need Dr. Dinosaur. I will not do it. I will ensure that Vermont's children have health insurance. We cannot do the work that we're doing here at this center if our kids are not healthy. I think that's a basic value that Vermonters have embraced. These are the choices.
But Senator, we know you've worked on budgets in the past and that you have quite a bit of experience. I think what's unclear to many of us here, at least me, is how you're going to do that. I mean, you haven't explained. On Sunday night you said you'd look at performance contracts. You didn't tell us how much you'd save by doing that. You've given us no clear plan about how you would balance what looks like now a $200 million budget gap.
I think it's
So,
110.
well, it's 110 plus 72 for challenges, plus 10 for a BAA possibly. So it's potentially $200 million. So how are you going to get there?
You know, I've been much more specific than my opponent about how I'd make those cuts. I could not have sat here last October and told you how exactly, line item by line item, we were going to balance the budget in January, or February, or March, or May. What I can tell you is this. Brian's proposal so far to cut the budget is to get rid of interactive television, which would save you less than $1 million. I have put out 3 concrete proposals that I intend to work on as governor with the legislature to help reduce spending. The first is I'm going to go much more aggressively after the performance-based contracts that we should have for the quarter of a billion dollars worth of outside contracts that state lets. In private industry, you get about 10% savings when you do that. 10% of $250 million is $25 million. I'm not committing to that number, but there's huge potential there. It's a lot more than $755,000 for Vermont Interactive Television. Second, I've made very clear that I'm going to go after the independent contracts that have been let over the last 8 years to hire state people who do the work of the state. I think that we get a better bang for our buck when we hire Vermonters to do our work, not outside contractors. And third, transparency. I've said very clearly it's not as much money as the first 2 areas I just outlined, but I've made very clear that I'm going to appoint commissioners and secretaries who have the skills to talk directly to the press and don't need spin doctors to block the press and the public from